Hello and welcome to the Recovery Channel. I'm Dr. Richard Whitney, Medical Director of Addiction Services at Shepherd Hill in Newark, Ohio. We're talking about treatment of individuals who unfortunately have developed the disease of opiate addiction. We've talked previously about how people get hooked on drugs and why they go back to drugs. Now, what is it that we in a treatment program do to help people remain free of this horrible, horrible disease called opiate addiction? We have a lot of misunderstandings and misperceptions in our society that people have to really want to go into treatment and give up this life of drug addiction and I want to get well. Well, I've been doing this for over 20 years and I've never had somebody waltz into my clinic and say, you know, I'm really tired of using drugs and I'm tired of the euphoric effect that it causes and the high that doesn't happen. People come into treatment only because the bad things that happen to them as a consequence of addiction drive them in, because the pain of using drugs is greater than the pain of not using drugs. So effective treatment does not have to be voluntary. As a matter of fact, we love it when people are involved in the legal system because the probation officer and the judge really will put the fear of God in somebody. I don't want to go to jail, so I'll complete treatment. But it doesn't have to be the legal system. It can be family members. If you don't go to treatment, I'm going to leave you. It can be employers. If you don't stop using drugs and stay stopped, I'm going to fire you. It could be financial problems. It could be health problems. One or many of these drive people into treatment, so we don't have to wait until an addicted individual gets ready to say, I'm ready to quit drugs. We want that to happen sooner, as soon as possible, so they don't develop a fatal illness like HIV or hepatitis. Interestingly, at the end of the year, whether someone is forced into treatment by the legal system or finally says, I've had it and come into treatment, at the end of a year, about the same percentage are clean and sober. So it's what happens within treatment that counts, not what gets people to initiate treatment. How long do people need to go to treatment? Well, it really depends. Obviously, younger people with a shorter duration of treatment who are using oral medications instead of intravenous drugs, using weaker drugs like codeine as opposed to potent drugs like heroin, generally can get by with shorter duration of treatment. Once people progress to severe addiction in the mid to late stage or cross the skin barrier and actually start using a needle, this is the late stage of addiction, and usually we find that less than 90 days of treatment is very, very, very ineffective. It doesn't all have to be done as an inpatient or residential patient. Some of it or most of it can be done as an outpatient, but not getting involved for at least 3 months of treatment brings about a very high relapse rate, and it's just, unfortunately, does not have the success rate that we want for people. And sometimes longer treatment, sometimes 6 months, 9 months of treatment is necessary for people to get the effects of drugs out of their brain and really learn a clean and sober lifestyle. Now, what type of treatment is best? Well, it varies from person to person. In general, we find, and I have found over my career, that it should involve education, it should involve helping people make a self-diagnosis, and it should be 12-step based, okay, with engagement in people in 12-step meetings like Alcoholics Anonymous and Narcotics Anonymous. Very importantly, we must treat the whole patient. If there are other psychiatric illnesses, if there are other medical illnesses, if there are social illnesses, we have to treat the entire person by developing a whole treatment plan for the whole person. We got to treat medical problems, social problems, vocational problems, psychological problems, psychiatric problems, marital problems. All these things need to be addressed to bring about satisfactory recovery. So what do we do when we get somebody in the door? Well, we screen them, make sure that they have the disease of addiction. We assess how severe the addiction is. We develop a treatment plan. We talk about counseling. We talk about drug screening. Without drug screening, a program cannot be sure an individual, because unfortunately dishonesty is such an important part of the disease of addiction. It's just like fever and cough are part of pneumonia. Dishonesty and denial and lying are part of drug addiction, especially opiate addiction. Very importantly, pharmacotherapy. That means we now have prescription medications that can really make us a very good impact on people staying clean and sober. and we continue to work with people over the long haul and get them hooked up with clean and sober friends, because people who hang out with their old drug using buddies just are not going to stay clean and sober over the long haul. They're not friends anyways. You really know who your friends are when you get clean. Your friends are going to support you. Your drug buddies are going to want you to come back using with them. What is the goal of treatment? Okay, how can we know treatment's going to be effective? Well, number one, what do we want to do? We don't just want to stop the drug use, but we want to return people back to productive functioning, taking care of their families, going back to work, making a living, paying taxes, driving a car, doing whatever they enjoy in life that they did before the addiction took hold. We know that good quality treatment reduces drug use over half, reduces crime by over 50%, and increases people's likelihood of keeping a job by over 40%. Now you might say, well, golly, is that all? I mean, is that as good as we can get? But when we compare it to other chronic, severe, incurable but treatable, progressive, relapsing diseases, like what? Like asthma, diabetes, cancer, depression, bipolar disorder, then a treatment of addiction has about the same recovery rate. So when we look at chronic illnesses, a 50% success rate is not good enough, but it's as good as a lot of other chronic illnesses. So rather than say treatment failed, he went to treatment and he went back to using again, we don't say that about asthmatic and diabetics. We say we need to treat them more intensely, longer duration, get this disease in remission, and it can work. And I've seen it work many, many, many times in my 20-year career. Now, what are the basics of treatment that I personally find to be most effective in any good quality treatment program? Number one, education. You have a disease. You're not a bad, dumb, stupid person. You didn't choose to be a drug addict. This is about a brain-based illness. Let me tell you about how it works, how it progresses, and what medications and drugs must be avoided for the rest of your life for you to stay in treatment. That education is absolutely critical. We help people make a self-diagnosis. Why do we do that? Isn't it good enough for the doctor to make the diagnosis? Well, the answer is no. People have to really believe that they have disease. Are you going to believe and take chemotherapy? If you don't really believe in your heart of hearts that you have cancer, are you going to take these toxic drugs and have your hair fall out? No. If you don't really believe you're going to have that you have diabetes, are you going to shoot yourself with insulin all the time? No. If you don't really believe in your heart of hearts that you have the disease of addiction, why should you avoid drugs and alcohol, complete treatment, go to meetings, work with your sponsor, etc., etc.? So we have to believe it. That's called a self-diagnosis. I have diagnosed myself. Then we teach people to take self-responsibility. They are their most important doctor, not a doctor over here or a wife or family members. I have to take self-responsibility for taking care of my illness and self-treatment. I'm the one that's responsible for what goes into my body or not. I'm the one that has to go to treatment. I'm the one that has to go to continuing care or aftercare. I'm the one that has to go to 12-step meetings. And if I do these things, then I can get well and stay well. We teach patients drug resistance skills, how to say no, how to avoid areas where chemical use is likely to be present. Replace drug using activities with non-drug using activities. Develop problem-solving skills to deal with stress and adverse consequences. So rather than go back to use drugs because they feel bad, they have non-chemical coping skills. Increase levels of motivation, improve levels of interpersonal relationships. Again, all of these areas are very important for improvement so people can have these skills and not fall into a pattern where they're set up for using chemicals again because they just can't handle life without drugs. Now, does AA and NA really work? Do these 12-step meetings really bring about a substantial improvement in people's lives? The answer is without question. That's not just guesswork. There have been clinical studies. How does it work? Well, number of meetings, the frequency, the timing, how people are progressing in their recovery, working the 12 steps. Very important because if people continue to do that, they get better and better and better. People who have a sponsor, read the literature, work the 12 steps, get involved in service work, and regularly contacting and spending time with other people in recovery, very critically important. That's why AA works and NA works, as people get involved in a program that's been shown to work for many, many decades. We know that at least 3 12-step meetings a week is pretty well the minimum threshold for efficacy, and people who do this, at least 3/4 of them stay abstinent. So if we take everybody in a bucket, about half or so will stay clean and sober, and sometimes we'll need extra treatments down the line. But we can increase that very substantially for people who really become active in 12-step meetings, get rid of their old using buddies, and embrace a new lifestyle that includes a lot of people who have been where they've been and are remaining sober. Now, is it really worth all this money to send somebody to treatment? Shouldn't we just, save the money for people with other diseases? And the answer is no. It pays society back to invest in treatment for those people in our population with this horrible illness. It costs $20,000 or $30,000 a year to put somebody in prison. Why not spend that much money to treat 2 or 3 or 4 or 10 people with the disease of addiction so they'll stop committing crimes and stop using drugs? It's a much more logical investment to invest in our people rather than locking them in a cage. Every dollar invested in treatment yields at least $7 in reduced crime-related costs, victims, businesses, legal system, hospital systems. So if I gave you if I gave you $7 every time you gave me $1, I bet you'd give me $1. This is a good investment with an excellent return on investment. Actually, we can increase that even to $12 for every dollar invested when you include healthcare costs. And of course, as we all know, drugs cause a lot of healthcare conditions. Reduce problems in the family, less child abuse, less spousal abuse, people working on the job, producing a lot more for their bosses and for their companies, fewer drug-related injuries and accidents and trips to the emergency department. So how can we look at someone when they're coming into treatment and say, you're a really good candidate, I think you're going to do well in treatment, and let's see if we can improve your success? Number one on the list is support from family and friends. It doesn't have to be there, but boy, it really helps. When the family is still intact and the friends are all saying, we want you to get well, we'll be there for you, that really helps. Adequate health insurance and financial resources. This is a truism in our society. You have to pay for treatment, but good insurance, good financial resources, good quality treatment, higher incidence of recovery. Pressure to stay in treatment. When the going gets tough, the people who quit and leave treatment go back to using again. But if we have someone hanging over their head, like family members, wives, business owners, bosses, judges, probation officers, then people tend to stay in complete treatment, which brings about a better result. People become motivated to change after they get the drugs out of the brain. Don't lose hope on somebody saying, I can't stop because the brain can't think clearly when there's heroin and other opiates in the brain. Once we get people clean and sober, they start thinking better and they say, I do want to stay sober after all. And adequate lengths of treatment. This is very, very important. Again, as we said earlier, 90 days of treatment tends to be the critical length. Some of that can be outpatient, inpatient, residential, but engagement in a good quality treatment program with a good quality treatment team for 3 months or longer brings about the best results. It can be very effective when delivered appropriately. Treatment works. Do not lose hope. Just because somebody has been to treatment before, been detoxified, goes back, does not mean they can't get well the next time. Indefinite remissions are produced. People aren't cured, but they never have to drink and drug again. It reduces substantially health problems and medical costs, family disruption, divorce, economic damage, and absenteeism at work. All these things get better with good quality treatment. This is a treatable illness. And we're going to talk later about medication-assisted treatment, how dramatic advances in pharmaceuticals by some drug companies have really brought about good medication which can substantially improve our outcomes.